I'm concerned. Things aren't going the direction we want. I think this would be a great patient to discuss with the TeleCritical Care Consult Service at Providence. I think they could give us some good advice. Maybe you can go out and get someone to bring that robot up.
Providence TeleCritical Care allows doctors in remote locations to consult a critical care specialist quickly and conveniently.
Hi, I'm at Providence Hood River Hospital. I'm calling for a TeleCritical Care consultation.
When a hospital calls us to get us to be involved, we respond within 20 minutes and guarantee that we're going to be able to help the providers, give them some key recommendations on what to do and the next steps to take in terms of stabilizing and making sure that the appropriate treatments are provided for their patients.
Hi, I'm Dr. David Hodgkin, one of the intensivists at Providence Portland Medical Center. What seems to be going on?
Hi, Dr. Hodgkin. I'm Dr. Lou Libby. I'm with Providence Hood River. I'm a family physician, and this is Helen, one of our critical care nurses, and we appreciate you taking the time to help us out today.
When it's 2 in the morning and you're in the intensive care unit with a patient in a small hospital, it's very easy to feel like you're all alone. It's really nice to have somebody backing you up, saying, gee, you know, you're doing the right thing, or saying, we would like to help you by having you send to Portland.
We sit in a control room at either Providence, Portland, or at St. Vincent's, and we use the video card that we can look into the room, look around the room, see the patient, see the monitor, see the ventilator, and have discussions with the care providers, including the nurses, the respiratory therapists, the physicians that are taking care of the patients, all in real time right at the bedside.
How much oxygen is he requiring now?
Well, he was on 2 liters when we admitted him. Brought him in here. Now he's on 100% non-rebreather, and his sats are finally over 90.
So some of the key benefits to the telecritical care consultations are that you get real-time, immediate access to board-certified critical care physicians. You have availability 24 hours a day, 7 days a week, and also the availability to try and keep patients in their local community rather than automatically transferring a patient from a smaller community out to Portland, which is more taxing to the patient and is often very difficult for families who then have to travel long ways in order to visit their loved one.
Could I take a quick listen to his lungs?
You grab that stethoscope.
Okay, you ready there, Coachman?
I am. Go ahead and put it on his
Take
lungs.
a deep breath in and out.
Hey, can you move it to the bottom of his lungs?
Same thing again.
A stethoscope on the robot allows both the healthcare provider in the room as well as the consulting doctor in the remote location to listen to the patient's heart or lungs at the same time. There's also a handset on the robot that lets physicians discuss with each other the details of the patient's condition and the specifics of the treatment options.
Okay, well, I've got the x-ray right here, and you can see this is where his initial pneumonia was. And it looks like he's developing the second infiltrate over on the right side of his lung as well. So he's developing a bilateral pneumonia, and we probably need to make some changes to his treatment regimen.
The hospitals can take their digital radiographic images and actually send them to me electronically so that I can view them in person at my control station. I can look at CT scans and chest x-rays and other x-rays at the same time that I'm looking at labs, and it allows me to look at everything that's already been done for the patient.
Well, that spread of the pneumonia to the right side certainly explains why he's a lot more hypoxemic. What do you think we ought to do next?
Well, I think that given the bilateral infiltrates, we probably need to expand his antibiotics, and I'd recommend adding azithromycin and vancomycin, but just keeping the ceftriaxone going.
Yeah, it's a wonderful program because it gives a rural doctor backup, the ability to get a formal consultation from a intensivist, and it allows you to take care of patients that you might feel uncomfortable taking care of.
Are there any family members that want to talk to us?
We can also have a dialogue with the family who might be able to provide us some more information and get more information than we can via the typical consultation just over a telephone with the provider. Just like any consultation that's going to happen in the hospital. After the initial evaluation of the patient, we're going to put together a handwritten note as well as a full dictated report that not only provides our initial assessment of the patient, some initial recommendations, but also recommendations for the ongoing care of the patient to really help the providers that are at the bedside follow through the next several steps that would need to be taken in order to ensure that the treatment plan is carried out.
I appreciate that. This is real helpful, and we'll get those things going, and if things don't improve, we'll let you know and get them up there.
Do you have any other questions for me?
No, I'm just glad you're available, and if things aren't going well, we'll call you back or transfer them.
Telecritical care is very exciting. I think it's probably one of the waves of the future, and I've seen it work and save lives.